A hearty good afternoon to everyone, and welcome to a session on the topic of preconception care before ART. How to prepare yourself. We are pleased to have Dr. Shivali Tripathi among us to educate us on the topic. Dr. Shivali is an experienced gynec and chief fertility consultant at Apollo Fertility Center, and we are pleased to have her as our esteemed guest to shed some light on the topic. Doctor, you have the stage.
Thank you so much. Thank you for the warm welcome. Uh, Namaste from Varanasi. This is Dr. Shivali. Today we are going to discuss a very important topic. We all know what has to be done when one conceive, but we don't know what we can prepare, what we can do before conception. So today we will be talking about preconception as well as periconception care. So to start with, next slide please. Um, First, we will understand what is periconception period. As the name suggests, it is the period which is around the conception. Some time before sometime before the conception, sometime after. And how much is this time? This periconception period is defined as 14 weeks or 3 months before and 10 weeks after conception. What is importance of this period? Why we are talking about this? Because we all know that it is a very critical period in terms of having substantial impact on fetus growth and development. Whatever gametes take part in pregnancy, they are being selected 3 months beforehand. So it compasses period of gametogenesis, and after the conception, the 10 weeks period compasses organogenesis in the baby and placental development. So if we want to change anything or if we want to improve anything which has to be done will be most effective if done in this period. This period only sets entire tune for antenatal as well as postnatal period. Next please. Uh, Now we will understand what care we can provide. So periconception care is the interventions to identify biomedical, behavioral, as well as social risk to the woman health and pregnancy outcome. The purpose of periconception care is to modify risk. By some intervention, we can modify the risk by preventing, and if there is some risk, we can manage also, so that we can maximize the outcome of pregnancy both in terms of mother as well as baby's health. So, if we talk of which visit is the most important visit, if we are planning for pregnancy, it is the periconception care visit. It is the most important visit in context of maternal as well as fetal outcome. On one hand, it identifies the potential risk for mother, what risk the mother can have during the antenatal period, and the baby also can have, and also it provides opportunity for us as a clinician for the counseling regarding preparedness to pregnancy, if any genetic counseling is required, as well as further family planning. Next please. So, what care we provide in periconception care? What information we give? We give information regarding timing of pregnancy, when a couple should try to conceive. We also take the reproductive history. What was the previous methods of pregnancy? What was the outcome? What medication the lady is already on, and what is safe, what is not safe, what medication should be avoided when you are trying to conceive, what infections are there which can be transmitted from the mother to the baby, also what immunization we can offer to the lady who is contemplating pregnancy, if any genetic screening is required, and also we take in very detailed family history to identify is there any problem which is running in the family which can hamper this pregnancy also. And we assess the nutritional status of the lady, whether she is malnourished, whether she is obese, what supplements we need to give, so that we can optimize the mother as well as fetal health. Next please. So, our objectives of periconception care is to do the checkup, to provide advice, to provide education about the pregnancy and preparedness, and also support the pregnancy. We can manage minor ailments of the pregnancy. We can screen for possible congenital malformations if there is any history of congenital malformations previously, or if there is any drug exposure, infections, etc., which can cause congenital malformation, we can screen for that also, and chromosomal abnormality. Also, we can prevent and detect the risk factors, we can manage them. There are some cases in which fetal medicine expert is required. Those are high risk pregnancies. Those need to be identified at earlier stage and referred to the specialist. We can also prepare ourselves for pregnancy, for delivery and newborn care as per the case. Next, please. So our aim to provide preconceptional care is to improve maternal, paternal, and child health in both long and short term. Like we can do the intervention so that the child, which will be born, should not have long term complication, metabolic syndrome, diabetes, hypertension. All those disorders are multifactorial disorders. Starting of these disorders are from gene only, so we can take precaution for that also. We can provide appropriate and comprehensive preconception care, and advice regarding lifestyle advices to optimize the health of the mother. We can also provide advice to optimize chronic maternal health problem. If a lady is suffering from diabetes, hypothyroidism, hypertension, cardiac illnesses, epilepsy, or some other autoimmune disorders, we can first optimize those disorders and then advise her to get pregnant. We can also identify couples who are at risk of having a baby with genetic or chromosomal malformation. We all know that there are 3 to 5% chances of congenital malformation even in low risk population. So in preconceptional care, our aim is to identify these prospective couples and to provide them adequate help. We also empower the couple by providing them with sufficient knowledge, and also we help them to make informed decision. We make them knowledgeable enough so that they can take their decision what to do and what not to do. Next, please. So there are some identifiable factors which can lead to adverse pregnancy outcome. Like if a girl is less than 18 years on her at the time of conception, whether it is spontaneous or ART pregnancy, she is at risk of developing hypertensive disorders and low birth weight in the baby. If the lady is more than 35 in years, we know that as the age advances, there are chances of more chromosomal abnormality, and also these ladies are at high risk of developing hypertensive disorders of the pregnancy as well as IUGR. If a lady is having previous ectopic, then in this conception also she might have ectopic. There are like 10 to 15% chances, more chances of developing recurrent ectopic in such ladies. If a female is having previous stillbirth or neonatal death, then this time also she is at risk. We need to identify the cause, whether it is recurrent cause, whether it has to be corrected first. If the previous baby is less than 2 stand, like if they are IUGR, if they are low birth weight baby, then this pregnancy is also at risk of developing IUGR. If a baby is more than 2 standard deviation, like large gestational age babies, so this time this lady might have gestational diabetes or large gestational age babies. Again, the ladies who are having previous preterm deliveries, there are very high chances of recurrence. Again, if a lady is having previous delivery by cesarean, or she has undergone myomectomy or some uterine surgery, in this pregnancy she might have rupture, preterm labor, IUGR. Again, if there is any first degree relatives are suffering from diabetes, then the lady is at high risk of developing gestational diabetes, which is diabetes in pregnancy. Again, if a lady is having previous abnormal baby, congenital anomaly is there, then again the chances of recurrence is there in this pregnancy. Similarly, a lady who is having medical disorder. So, if she is having diabetes, hyperthyroidism, heart disease, hypertension, epilepsy, SLE, rheumatoid arthritis, so these diseases can complicate during pregnancy. So, we need to identify and optimize these disorders beforehand during preconception period only. If a lady has conceived with IUCD, intrauterine contraceptive device, then there are high chances of miscarriage, and if the pregnancy has sustained, then there are also chances of preterm labor. So before embarking into pregnancy, such ladies should have a good periconceptional visit with the professional expert. Next, please. Also, there are some ladies who are having previous history of congenital and genetic abnormalities. They are having family history of congenital and genetic abnormalities. There are some there are some children in their family who are having some congenital problem, or there are history of hemoglobinopathy like thalassemia, like sickle cell disease, like G6PD deficiency. These disorders run in pregnancy. You might have some people who are identified and some who are not identified. These couples can be very well diagnosed in preconception period, and major disaster like thalassemia major etc can be prevented completely. There are universal policies in European country where they screen all the couples, like as we are doing blood group, they are doing HPLC, they are doing testing for hemoglobinopathy, so that no thalassemia major should deliver. So these couple are very well catch hold we can catch hold these couples in preconception care. Also, if there is history of any chronic medical disorder, a family history of chronic medical disorder, we can take precaution so that these ladies do not land up in any problem during their pregnancy. Next, please. So there are again some groups who are at high risk of having a baby with aneuploidy, like females who are having family history of genetic condition, mental retardation, perinatal death, birth defects, infant surgery, familial cancer syndrome. So these ladies are at high risk of having a baby who is aneuploid. So we can in ART we can identify these couple. We can provide genetic counseling to them. We can go for PGD for such couples also, so we can very well prevent these conditions to happen again. Next, please. We all know that as the age advances, as we can see in this chart, as the age advances, there is more chances of Down syndrome, which is trisomy of 21. So adequate counseling beforehand and adequate prenatal testing should be offered to these couples who are embarking to pregnancy in advanced stage, either spontaneously or through ART. Next, please. It is almost we I have told that if there is any history of hemoglobinopathy in the family, or congenital anomalies or genetic anomalies, we need to identify these couple with red flag. We need to do the genetic counseling. We need to optimize the couple, and also we can provide, like in IVF we can provide PGD. In if the conception is spontaneous, then we can there are lots of prenatal testing in form of anti-scan, in form of dual marker, triple marker, quadruple marker, in form of NIPT and invasive testing, so that we can catch hold these patients early and can prevent the adverse pregnancy outcome. Next, please. So, you must have heard of torch infections. Torch infection is a group of infection which can be transmitted from the mother to the baby. It consists of toxoplasma infection, rubella infection, cytomegalovirus infection, herpes simplex virus infection, and parvovirus infection. So, if a lady comes to us for prenatal care, we can screen those ladies with torch profile, and also we can advise like toxoplasma is transmitted through exposure or consumption of raw meat, or if you are having a habit of pet cats and handling the excreta with bare handed, then there are chances of toxoplasmosis which can severely affect the baby. So in preconception care we can make aware such ladies how to handle the excreta. Again, rubella is an infection which can cause congenital rubella syndrome, which is a very severe form. So we can catch hold the ladies who are not immune to rubella. We can immunize them. Similarly, with CME and HSV and parvovirus, we can screen these ladies, and in again the baseline test if we are having, we can later compare in antenatal period and provide the adequate health. We can also teach these couples about the healthy sexual relations, and about STDs, drug abuse, etc., because these all infections are associated with those factors. Next, please. Thalassemia, as I have already told, thalassemia is a hemoglobinopathy, which is a like it is autosomal. recessive disorder. So there might be family members who are carrying this, they are carriers, and if both mother and father are carrier, then there are 25% of chances that the baby can be thalassemia major. So in periconception care, we can identify these couple, we can prevent such birth, because we know that thalassemia major is a very major problem. These children are like, they need very frequent blood transfusions, their life expectancy is not much, so these births can be prevented. So this is, these couples are very well identified in preconception care. Next please. Okay, so I was talking of chronic medical disorders. Like we know that India is a capital of now, capital of NCTs, non-communicable disease. Diabetes is making major chunk. We are getting patients who already having diabetes, or almost like 75% of patients are having family history of diabetes. So what diabetes causes? The baby is not having her or his pancreas or thyroid functioning initially. So mother's thyroid and mother's insulin makes important role in organogenesis. If a lady is diabetic and she is not controlled, she is uncontrolled diabetes, so there are like 30 to 40% chances of major congenital malformation in form of cardiac defect, in form of neural tube defect, spina bifida, anencephaly, hydrocephalus, caudal regression. So in preconception care, we can very well control the sugars and then advise to enter in pregnancy. As in this chart, we can see HbA1c levels. If it is more than 15%, there are almost 40% of the chances that the baby might have serious congenital malformation. So we need to first optimize the sugars before entering into pregnancy. Next, please. Okay, these are the CDC guidelines. This is basically for European countries. This is general advices what has to be done in diabetes, hypothyroidism, phenylketonuria, what to be done for people who are on oral anticoagulant like heart disorder patient, what epileptic drug if you are having taking any epileptic drug, because drugs are also, FDA has divided the drugs in 5 categories. Only these categories are A, B, C, D, X. A and B is considered safe, and the drugs which are in C, D, and X, they are not considered very safe to be taken during pregnancy or if you are planning for pregnancy. So whatever drug you are taking, you need to understand which category does it fall. So if a patient is on, like there are many anti-epileptics which are not safe in pregnancy, which can cause serious malformation in the baby. So there are guidelines what drugs has to be changed for same. Similarly, vitamin A or isotretinoin use, like people are having acne and they are using over the counter drugs which can cause serious problem in the baby, so that should not be used. Before landing in pregnancy, one has to be screened for HIV, hepatitis B, C, syphilis, and also there are some supplements, folic acid, vitamin D, calcium, iron, vitamin B12, which has to be supplemented in proper doses before starting into pregnancy. Again, illicit drug use or smoking and alcoholism, there is no safe limit for safe. So smoking is completely prohibited, alcohol consumption is completely prohibited if you're trying to conceive, and no recreational drugs should be used because these all can cause serial malformation in the baby. Similarly, we need to, I will be telling in next slide. Next, please. Okay, so target blood sugar is 95 fasting, and if like HbA1c we are considering, it should be less than 6.2 to 6.3, and average blood sugar any value should be less than 120. Next, please. Next, please. Okay, so we get a lot of question what to eat, what not to eat when you are trying for pregnancy. If the usual requirement for a woman, healthy balanced diet, we need 2000 kilocalories. Ideal BMI is 19 to 25. So who are overweight, they are like people who are having BMI more than 30. They are almost 11 times more exposed to have gestational diabetes. and they can have complication like miscarriages, very frequent miscarriages. They can have shoulder dystocia during delivery. They can have pph. And also people who are underweight, they can have growth restricted baby. So we need to keep our BMI. We should plan a diet such so that the BMI should be between 19 to 25. What is BMI? Body mass index, your weight in kg divided by your height in meter square. This should be kept strictly between 19 to 25 before you are thinking of pregnancy. And if you are little oversized or towards higher side, then lose at least 5 to 10% of weight. Do exercise, do walking. It will help you as well as your baby too. Next please. Folic acid in 90s, like there was lots of cases of neural tube defect. Later it was studied that if we supplement folic acid in preconception period, we can prevent 90% of these cases. So what is the recommendation? For people who are not having any family history of folic acid, this thing neural tube disorder, they can have 400 microgram of folic acid daily while planning for pregnancy, and they should start it 3 months before conception and continue at least for 3 months after pregnancy. People who are at high risk of having a child with neural tube defect, like people who are having such family history, they are having such children before, they are in diabetes, they are having epilepsy and malabsorption syndrome, these patients are advised 5 milligram of folic acid 3 months before and 3 months after pregnancy. Next please. About vitamin D, we all know that vitamin D is very important for calcium absorption, and it is important for maintenance of healthy bone and teeth. So, insufficiency of vitamin D during pregnancy may result in calcium deficiency. It can harm both mother as well as baby. It can lead to maternal osteomalacia, maternal bone weakness, as well as preeclampsia. And in baby, it can cause low birth weight and increased risk of neonatal seizures after birth and childhood rickets. So, what is the dose? For normal weight females, 400 IU is the sufficient dose. For people who are at towards higher BMI, they should be supplemented with 1000 IU. And the people who are found deficient, in whom the vitamin D deficiency is diagnosed, those has to be treated in therapeutic dose, which is almost we give in India 60,000 IU weekly for 4 weeks, 4 to 6 weeks, and then once in a month as maintenance dose. Next, please. About iron and vitamin B12, the most common nutritional deficiency and cause for anemia in India in pregnancy is iron. So, other nutritional deficiency which can cause anemia is vitamin B12 deficiency and folic acid deficiency. Folic acid deficiency we are already treating because we are giving 5 mg for neural tube defect. So, good iron in diet is usually advised when you are thinking of pregnancy. And iron rich food are like red meat, seafood, beans, dark green leafy vegetables, dried food, dry fruits, and peas, iron fortified cereals, breads and pastas. And the ladies who are like found deficient, who are already anemic to start with, we can start iron in therapeutic dose in those females, because anemia in pregnancy can cause premature birth. It can cause IUGR. It can cause like PPH. It can cause heart failure in females. So it has to be treated beforehand. Next, please. So, what are the take home messages from this talk? Seek for professional help if you're trying to conceive, for preconception checkup and counseling. Because if we talk of all visits during antenatal care, postnatal care, the most important visit is prenatal care. If preconception care, if your start is good, then the end has to be good. If you are prepared properly, then the outcome will be good. Healthy lifestyle, if you're thinking of pregnancy, shift to healthy lifestyle. The sleep should be proper, the diet should be proper, your body weight should be maintained. It should not be very less or very high. Walking is very good exercise, at least 40-minute walk, brisk walk is advised for everyone. You should abstain from smoking. Like, people ask us how many, like, can I smoke one cigarette or can I take one glass of alcohol? So there is no safe limit for these things. Smoking, alcoholism, and recreational drug like bhang, marijuana, charas, these things are not completely abstain from these things. Also, start as soon as you are trying for pregnancy, whether it is through IVF or spontaneous conception. You should start folic acid 5 mg for both partners, because DNA content is coming from both parents, from male as well as female. So there are female, like, there are couples in whom the father thinks that everything has to be taken by the wife only. So this is not so. Both partners should take folic acid. Since India, in this northern region, hypothyroidism is very common. Our food is mostly iodized. We are using iodized salt, so iodized salt should be used to avoid thyroid deficiency. Vitamin D and calcium is very important. To prevent any postpartum complication, it has to be started in right doses. We should consume our food rich in iron, protein, vitamins, and minerals. And if not immunized, or if found seronegative for rubella and hepatitis, then these vaccination has to be taken. Pregnancy should be postponed for 1 month, and then you can try for pregnancy. Next, please. Yes, if you are on any medication, like if you are already diagnosed case of diabetes, hypertension, or thyroid, or there are some autoimmune disorders like SLE, like rheumatoid arthritis, like systemic lupus erythematosus, or like sarcoidosis. So, and also there are some patients who are having who are taking antipsychotic medicine, or known case of epilepsy or heart problems. So your drug might not be safe to conceive, because it can cause serious malformation in the baby. So you need to talk to your physician if you are trying for pregnancy. Also, in for autoimmune disease, these diseases are having periods of remission and periods of aggravation. So pregnancy is advised during periods of remission only. So you need to talk to your physician when you should try for pregnancy if you're suffering from any autoimmune disorder. Also, if you're taking any medicine, just talk to your physician what medication you need to change before trying for pregnancy, because it can harm you also and your baby also. There are screening available for thalassemia, for sickle cell disease, for G6PD deficiency, and it has to be ideally done routinely. But it is not it is not possible in India to. But we can definitely counsel and advise and allow the couple to make informed decision about that. If any genetic disorder is already identified in family, or it is in previous pregnancy, then you should first go for genetic counseling and then only try to enter in pregnancy. As I already said, that toxoplasmosis spreads from cats' fecal material. So if you're having like pets in the family, then kindly wear gloves before doing handling the cats. Do not use over-counter medicines, because uh, 80% of the medicines are not safe in pregnancy. So without talking to your gynecologist, do not take any medicine when you are trying to conceive, because in initial 14 days, when the embryo has just started, when the pregnancy has just started, it is a period of all or none. Either the pregnancy will abort or it will continue. So even one single tablet might make a difference. So you need to talk to your physician before taking anything over the counter. Stay away from radiation exposure. There are like variable amount of radiation exposure in different x-rays, like chest x-ray, abdominal x-ray, thorax x-ray, pelvis x-ray, CT scans. So you can talk to your physician what amount of radiation is safe. Ideally it is very less. 50 centigrade is only 50 cg is only safe. So you need to talk to a physician or gynecologist before going for any radiation exposure during pregnancy or when you are trying for pregnancy. And also, do not consume raw milk meat, because it might lead to some infections which can be transmitted from placenta to your baby. Next, please. Okay, thank you so much. I think I have given a lot of information regarding preconception care. It's a time of preparedness. You need to plan your pregnancy. You need to see a physician before planning a pregnancy, either through IVF or ART or spontaneous conception. If you're having any question, I'm open for all the question and discussion. Thank you so much.
Thank you so much, Doctor. It was a pleasure having you. And if there are any more questions, you can put them down in the comment section and we will have them answered. Thank you, everyone, and see you soon. Thank you, Doctor.
Thank you.